Well, today with us we have Dr. Pawan, and he is practicing in Delhi NCR. We're going to be talking about BPH because it's a very important problem these days. Sir, very welcome. So the very first question I would like to ask you, why according to you are the cases of BPH on a high rise these days?
Actually, what happens, let's compare it with what happened in India after 1947. The life expectancy was 50 years, to be more precise 48, 49 years. Nowadays, the government data shows life expectancy to be 70 to 73 years. Even few of the states have life expectancy of 78 years also. So as your aging process occurs, the incidence and prevalence of prostate disease increases because it is a disease of aging. Just like the hairs go white, the prostate enlarges. So aging, the more the number of patients you will get here.
Well, why according to you it becomes very necessary for a patient who is suffering from BPH to be diagnosed at an early stage and not in later?
Very important question. I would like to take this platform as an opportunity to tell you that the symptoms of prostate cancer and prostate enlargement is same. So when you see a patient, you examine the patient, we call it a digital rectal examination, where we put in a finger in the rectum or anus and see the consistency of the prostate. Secondly, we get a test known as a PSA, it is a prostate specific antigen, but for layman we usually call it prostate safety awareness, so that a layman can remember this topic. These two tests will help in determining whether the patient is having prostate cancer or not. On that basis, we are able to detect early stage prostate cancer which can be cured to a full extent.
Well, if you could share some instance where the patient were too late and the water was overhead.
I will share two incidents, one the early stage and late stage. Early stage, one of my patients came to me with a PSA report.
Okay.
So I just asked him, why did you go for a PSA test? He told me, I was taking a lift from my friend. I saw a report over there mentioning PSA. I just asked him, why do you get a PSA done? He said it is just awareness. So I got a PSA done, and I just, so my PSA is normal, so I'm happy. I'll live more long. So this thing got in his mind. Then he went and got his PSA done. That PSA was higher. He didn't have any symptoms. And when we investigated him, we found that it was a cancer prostate. We did a radical prostatectomy, and he is very happy. He is visiting us and he is enjoying his life. So that is one example. The second example is patients from rural area who come to us. These patients are from rural area who say, I have a symptoms for 2, 3 years, 4 years, 5 years down the line. And we examine them, they have a hard prostate. And then definitely PSA is very high. So when PSA is high, we evaluate him. It is a metastatic disease. So we can't operate and go ahead and remove the prostate because the cancer has gone to bones, cancer has gone to different parts of the body. So it is not a good thing to operate on them because you will not be able to give them a good life expectancy. So we treat this patient on a hormonal therapy, which just give him a better quality of life and slightly increase the expectancy of life also.
When does the surgical intervention comes into the play, and is there any possibility that a patient can avoid this?
Yeah, I'll ask this question answered in two parts. Number one, in prostate patients, benign enlargement of prostate. These are those patients who don't have cancer prostate. Now these patients around 80% of the patients can be very well treated with medicines. And there are good number of medicines, so 80-90% of the patients are very happy on medication. It's only 10% of the patients who undergo surgery, and that too minimal invasive surgery, that endoscopic surgery where the patient is operated today and discharged the next day.
Right.
And coming to the second question, as a cancer prostate, we need to see whether it is localized. If it is localized, we do a robotic radical prostatectomy where we remove whole of the prostate. And luckily, if the prostate cancer is restricted to the prostate, he is completely cured. We keep a follow-up on these patients and manage them accordingly.
Wonderful. Well, any lifestyle modification a patient can have?
Yeah, for prostate enlargement, benign prostate enlargement is nothing like that. But for cancer prostate, avoid animal foods. Insist more on fruits and vegetables that have a protective effect on cancer prostate. High lipid diets provokes cancer prostate, so that has to be avoided.
Well, any take-home message for our viewers?
Yeah, definitely. If you have any symptoms pertaining to urinary tract, you and your friend, be cautious, consult a urologist and get a PSA done. PSA for you is prostate safety awareness, so that you can remember it. You can get it done on your own, need not to have any prescriptions, and that will help you. And consult a doctor also.
Wonderful. Thank you so much, sir, for your valuable insights. We're very glad to have you.
Thank you. Thanks.